Okay. Hello, everybody. Good afternoon. Thank you for being here. Mayor Walsh is here as well with us today. Thank you, Mayor, for being here. I think we'll go over some data, some related points. The Mayor will give us an update on some of the social distancing efforts in the city of Syracuse and a couple other updates that they've been working on, and then we'll take some questions. So presently, do we not have our new chart here? Josh, all right, look, we're off to a bad start already, everybody. I don't know what's going on here. But presently, look at it, serves at the pleasure of, Andrew, serves at the pleasure of. Thank you, Justin, for your great work. Presently, we have 537 cases. This is up from 520 yesterday. So we have 17 new cases. We have 49 individuals that are in the hospital. This represents 19% of our active cases. We have 21 individuals that are in critical condition. This represents 8% of our active cases. This has been something that we've seen a trend in, about 18 and 8 or 19 and 9. This is about where we are with comparing it to active cases. Out of the 49 individuals in the hospital, we have 29 Caucasian, 10 African American, 3 are of another race, and 7 unknown at this point, still trying to collect data. Of the 11, we've had 11 individuals that we have lost in this process. That is still the number today from yesterday. Today, there are 268 people who have recovered and have been released from mandatory isolation and quarantine. That is up 11 from yesterday. So we've had 537 positive cases. We are presently monitoring 258 active cases. The active cases are up 6 from yesterday. We had a good day of recoveries, but we also had 17 positive cases. 59 individuals out of our 537 are contact cases via household. We've always said that it's not just the risk of the positive case, but with every 10 positive cases we have at least one household contact from that. These are individuals that get sick because they've been living in the same premise as somebody who has a contact. We now have 1,084 people in isolation and quarantine. This represents our active cases of positive COVID-19 cases, but also the quarantines. This is part of the process and puts a lot of stress on our health department infrastructure. It's not just the work that goes into identifying the positive with the testing, but then the investigations and the quarantines, and then monitoring certainly the active cases and the quarantines. We have 287 female cases, 250 males, 14 individuals are under 19, 111 individuals are in their 20s, 76 individuals are in their 30s, 84 in their 40s, 98 in their 50s, 78 in their 60s, 42 in their 70s, 24 in their 80s, and 10 are in their 90s. 23% of our cases are under 30, 37% of our cases are under 40, 53% of our cases are under 50, 71% are under 60, 29% of our cases are over 60 years of age. Breakdown by municipality, 210 in the city of Syracuse, 61 in the town of Clay, 38 town of Manlius, 32 Camillus, 32 DeWitt, town of Salina 30, Cicero 26, Onondaga 26, Geddes 18, Lysander 18, Pompey 16, Skaneateles 10, Marcellus 4, Atisco 4, Van Buren 4, Lafayette 3, Tully 2, Fabius 2, and Spafford 1. Town of Elbridge still holding strong at 0, and Onondaga Nation still at 0 confirmed COVID-19 cases. Geographically, there's no real significance here. The higher populated areas are going to have more percentage of the cases, pretty consistent with the population. It's north, it's south, it's east, it's west. It's in the counties around us as well. Testing. So far, there have been 7,211 tests administered. We have 7,041 tests that have been returned, with 537 positive and 6,504 negative. We have 170 pending tests. We received 162 tests back yesterday. Reminder, we now have testing being done at Upstate, rapid testing, so we are getting some tests back within 24 hours. So when we look at that, we had a low of I think 68 pending tests yesterday. We had a busier testing day yesterday at all of our sites throughout the county. We thought that might happen. Not a lot of people going out and getting tests on Sunday or Easter. And so we'll see how that goes today and tomorrow and certainly Thursday. 7.6% of the tests that have been done are positive. Related to testing, we talked about how Crouse is also going to have their own rapid testing, but yesterday we received good news from St. Joseph's Hospital related to rapid testing there as well. It looks like their testing will be a 2 or 3 hour turn time. Obviously, Dr. Spinelli and Les Luke of St. Joe's, thank you for that. This is also really helpful. Our strategy is to test, quarantine, and then you monitor, you kind of create that box, that strategy, and for us to be able to do that quicker helps really contain the spread of this. The results after a positive test, same rules apply. Our health department's going to contact you. Your doctor should be contacting you as well. At that point, we'll start our investigation to look at potential contacts and direct contacts that you may have had. We reach out to the direct contacts that you have after the investigation. In the event that there's a gap in the investigation, we will reach out and let the public know about the gap in that investigation, about potential exposure to the public. Certainly, we want to thank all of our patients about their cooperation, utilizing our online tool that they have where they can put in their symptoms. Thank you for continuing to communicate with our health department related to text messaging, utilizing technology. This helps expedite the process of a release from quarantine or isolation. Certainly, the health department is the only one that can release you from that. We are now into our second week of our voluntary shelter in place with social distancing. We believe that social distancing is working, and we're starting to see positive data. I believe our curve today our yellow curve is flattened. We need to keep that flattened. How do we do that? We do that with social distancing. I read an amazing quote from a doctor today that said, we know this about the virus. We know it cannot swim in 7 feet of water. So that's something interesting to think about when you're distancing. The guidelines have been 6 feet. If we do that, we know that the virus can't go further than that. That's the guidelines now. And we have seen the yellow curve flatten. The green curve has started to move past our yellow curve, but the red curve hasn't flattened yet. And that's what we need to see. And how do we do that? Only you can help us with that by really starving this virus. At this point, I want to bring in the mayor so the mayor can give an update related to some of the efforts the city of Syracuse has been doing with social distancing and some other COVID-19 efforts. Mayor?
Good afternoon, everyone. Thank you, County Executive. There's been a lot of discussion lately around social distancing and enforcing both the governor and the county executive's executive orders as it relates to social distancing and essential businesses. I wanted to provide an update on behalf of the city of Syracuse, both as it relates to actions that we've taken as well as enforcement of those actions. So just as a recap, back on March 19th, we, the city of Syracuse, closed down all of our playgrounds and equipment in our parks. Then on March 27th, in response to a number of complaints about young people playing basketball, we removed our rims. Since then, we've also placed locks on all of our tennis courts. And I just want to use this as an opportunity to reinforce that our parks are still open, but they are only open for passive exercise where you can practice social distancing. Our parks are seeing a lot of use, which as long as it's done safely is still a good thing. In response to the increased usage, We established our weekend walks program in Upper Onondaga Park, Burnett Park, Thorndon Park, and Lincoln Park, where we closed the traffic loops to vehicular traffic to allow our pedestrians more space to walk and run safely, and that has worked well, so we are looking to continue that. Those actions have not been limited to the Parks Department. We've worked very closely with the school district. We've received reports on school district properties where people have been playing sports and congregating. We've addressed those as well. Superintendent LSA has confirmed that signage has been placed on all of their facilities, including fields and playgrounds, informing the public that they are in fact closed. In response to some recent activity, I think that the county executive was asked about yesterday, we have the school district, and in the cases where we control the fields, we have placed locks on all of the gates, providing limiting access to all of our large athletic facilities, our high school facilities, so Corcoran, Nottingham, Henniger, all of those gates are locked. It doesn't mean that people still can't get in. You can climb fences, but we've done everything we feel within our power to keep individuals out of those facilities, tennis courts as well on school grounds. All of that said, I think it's important to remind everyone that the vast majority of people are doing the right thing. It's the small percentage of people that are not following the rules, unfortunately, that are taking up a lot of our attention. So on that note, an update from the police department. So to date, the police department has received 237 complaints involving social distancing, whether it be individuals or non-compliant businesses. I want to be clear that the police department has responded to all 237 of those complaints and will continue to respond to every complaint that comes in. So if people have concerns about a non-compliant business or gatherings, please call 911. They will dispatch the police department and they will respond. So while those calls aren't broken down by code into non-compliant businesses versus individuals, I can provide a little bit of insight on how we handle those different situations because we do handle them somewhat differently. For businesses that have received complaints, generally we found that many of them, if not most of them, are found to be compliant, whether it was someone who had a misunderstanding of what was an essential business or otherwise. Many of the businesses that we've responded to, or a number of them, have turned out to be compliant. Those that were not were ordered to close down, and they complied. For those ones, for those that were ordered to close down, the police department wrote up a report, sent it to the New York State Attorney General's office, who has their own follow-up process. Of those non-compliant businesses who were ordered to shut down, and that number is 4 right now, none of those businesses have reopened. If they do, they will receive the $1,000 fine as allowed for within the governor's executive order. For individuals, our process is somewhat different. The last time I spoke with you all, I talked about the police department's approach for individuals, which has been to educate and inform. That continues to be their practice for a few reasons. Number one, because most individuals do comply once educated and informed by the police department of the rules. For the very small percentage who don't comply, we're faced with a really difficult decision. Do we put our first responders, and specifically our police officers, in harm's way by requiring them to further engage with these individuals who have already clearly shown that they don't have regard for their own health or the health of their loved ones? Do we want to put additional individuals, and specifically our police officers, at risk by asking them to engage with those individuals? To date, our answer has been no. When you look around at other communities, you have seen what can happen to police departments and fire departments when they are unnecessarily exposed to high-risk individuals. We've seen high call-in rates in fire departments and police departments across the country. To date, we have been very lucky that we have not seen that in our police department or our fire department. I said lucky, but actually there's a certain amount of luck for sure, but our police department and our fire department have gone to great lengths to minimize and to mitigate the health risks of our officers and our firefighters, and it's working. And again, we don't want to put our officers at a higher risk by requiring them to engage with individuals who, again, have already shown disregard for their and others' health, especially because even if the citation is issued, the ticket is handed over, the officers go on their way, and those individuals can continue violating the law. As with any process, we reserve our right to revisit it and to continually evaluate our approach, which we're doing. And ultimately, we reserve our right to change it. But right now, we just want to go back to encouraging people to do the right thing and emphasize that the vast majority of people are doing the right thing. So we need those that aren't to get serious about this again, because it's not just about you. You're being selfish because you're not only putting yourself at a higher risk, you're putting your loved ones and your friends at a higher risk. And in some cases, if our first responders and our police officers show up, you're putting them at risk too. And that's not right. That's it on social distancing. Happy to answer questions after the county executive finishes up. Just a few other quick updates since the last time I was at one of these briefings. We released our city budget last week, and we're projecting a $13.9 million deficit. Looking at the impact of COVID-19 on our current fiscal year, which ends at the end of June of 2020, and our next fiscal year, which begins on July 1st, we're projecting anywhere between $14.5 to $20 million overall financial impact due directly to COVID-19, largely through declines in revenue, but also costs associated with preparing for this crisis. Again, about 11.1 million of that is accounted for in next year's fiscal year, but we know, the county executive and I have talked a lot, and we know that our sales tax numbers are going to get hit hard at the end of this fiscal year. So again, all told, anywhere between 14.5 to 20 million, and that's just an educated guess. It's changing continually. On the positive side, we've talked a lot about our response to the business community. We know that our business community and especially our small businesses are really hurting. We announced last week that the Syracuse Economic Development Corporation SEDCO Emergency Loan Relief Program issued 29 loans, approved 29 loans, which accounts for about 90% of the $500,000 that was set aside. The first of those checks were mailed out on March 30th. We expect that more than half of those checks will be issued by the end of this week, likely more. 16 different neighborhoods represented by those businesses. And again, I'm really proud of the way in which our community, and specifically the SEDCO board and staff, mobilized quickly, and within 3 weeks had put almost $500,000 into the hands of our small businesses who need it most. We also, the county executive and I have talked about our economic resiliency task force. That task force met on March 31st as a full group. Since then, they've been meeting between 4 working groups. They're going to reconvene next week as a full working group. The 2 priority areas that they're focused on right now are the next federal stimulus and helping to inform that process and advocate for the resources that we need, as well as beginning to formulate a plan to get back to work. Again, always using the public health information and experts as our guide, but preparing for, both in the short, mid, and long term, getting our economy back into action. Finally, just 2 more reminders. 1, census form. If you haven't filled out your census form, please do. That has a direct impact on the federal resources that we receive to address a crisis just like this. And also, you may have seen that we launched last week a Say Thank You campaign, a hashtag Say Thank You campaign in social media, where we're acknowledging and thanking all of our essential workers, both in city government and beyond. Last week, we focused on our sanitation workers. This week, we are thanking our teachers. So I encourage all of you to thank all of our essential workers, but especially this week, our teachers who have done an incredible job. That's my update, and after the county executive finishes up, be happy to answer questions.
Thank you, Mayor. Why don't we go through a couple just numbers here that we do every day, but not everybody watches this every day. So Upstate Triage Hotline, that's our hotline. If you don't have health insurance, you are sick, you have symptoms, you call this hotline and they will screen you for a COVID-19 test at our Triage testing site. That phone number, 315-464-3979. Our seniors, our healthcare workers, and adult nutrition hotline. This is a service that we are providing now, which is meals, which is groceries, toiletries, filling gaps that we never, that many individuals in our community never had. That phone number, 315-218-1987. Our daycare program for essential workers, Child Care Solutions, 315-446-1220. If you're an essential worker, you have a gap in daycare or child care, we have over 1,000 slots that are open now that you can get free of charge for the month of April. 211 for social and emotional support. Please contact 211. Our mental health is being challenged day in and day out. If you need support, 211 has professionals there that can offer you guidance on how to get help. Please utilize that. Vera House support line, no excuse for abuse, 315-468-3260. If you find yourself in a situation you're uncomfortable with, please utilize Vera House and their services. McMahon Ryan Child Advocacy Center. Right now, again, many of our first mandatory reporters are teachers, and they are not with children every day. And so if you have certainly any questions about this or any concerns about any of our children, please contact McMahon Ryan, 315-701-2985. PPE donations, 315-435-2525. Again, the emergency medical equipment, various masks and protective gowns that our first responders and our nurses and our doctors are wearing. For whatever reason, if you have some and you can donate them, please donate them to us. We will make sure they get out into the community, into our nursing homes and our hospitals. Saying that, be happy to take some questions.
I just have a follow-up question for the mayor regarding the process with social gatherings. From my understanding, the first offense is they just get a warning, but then can you kind of repeat what happens after that? Like, is a ticket ever issued, or?
So again, for any of these cases, a warning has to be issued first. And as it relates to businesses, we look at when we file a report for a non-compliant business with the Attorney General's office, that serves as their formal warning. So if they are found to be in violation again, they will receive a ticket. To this point, we have not yet had to issue one to a business because they've been compliant after being shut down. For individuals, again, they have to receive a warning first, and that really gets back to my point about putting our officers in harm's way, because that requires actually for our officers to engage with those individuals twice. First as a warning and getting that individual's information, or many individuals' information, which then would serve to support the documentation for a formal citation. So at this point, rather than serving as formal warnings, we are uniformly applying an approach of education and information to all of those gatherings. And again, the good news is most people are complying. For those that aren't at this point, again, we have not been willing to risk the health of our officers by forcing the issue. We acknowledge the noncompliance, and we move on. Again, it's a small percentage of those calls that end up like that, and we're continuing to evaluate our approach. So, of course, we reserve the right at any point to change it and to start issuing citations, but these are generally people that didn't just start not following the rules or following the laws. These are individuals that generally have a disregard for the rules and for laws, and so chances are we've engaged with them before and will engage with them again. Oftentimes we're dealing with communities, poorer communities, where issuing a $1,000 citation isn't going to accomplish a whole lot, especially because it isn't necessarily going to change that behavior. So again, based on where we are now, we just we don't see the overall value in taking it a step further on enforcement, because I think what you've seen and what the county executive has shown is generally what we are doing, thanks to the leadership of the county executive and Governor Cuomo and everyone stepping up, is working. So we don't want to sacrifice that progress for a small percentage of people that don't get it.
The 237 number, is that have a start date to it, or it's as long as social distancing?
March 25th is the start date.
Thank you.
Mm-hmm.
Other questions?
Ryan, actually just down the street from News Channel 9 on Bridge Street, the East Syracuse Walmart parking lot looks very different. There's some sort of testing capability being opened up, but it seems somewhat mysterious to a lot of people. I'm wondering what your office knows about it, who's behind it, what the process is, and how it coordinates with your health department's plans.
Yeah, so we'll have a call with them about what that is going to look like. How everyone learned about it was interesting, and there's been no coordination with our health department yet. And I'll make the analogy for anybody that wants to do testing. We're very happy for people who could bring capacity, but if we want to use a sports analogy, which I often do, this is a baseball game. We're in the 7th inning. The baseball game could be over in 9 innings if we do what we're supposed to do with social distancing and whatnot, or it can go on for 10, 11, 12, 13, 14, 15 innings. So we don't change the strategy going into the baseball game in the 7th inning. So there's a strategy, and that's been going on, and that started very early on with our emergency management and all of our various hospital partners, our governmental partners. And so if there's new testing capacity that can come into the region, it needs to work within that strategy. So we'll have a call, and we'll figure out how that plays out and what role potentially that site could play, and how it fits in the strategy or how it doesn't.
Is it Walmart corporate behind it?
I think there's some reporting on, it's vague. It's Quest Diagnostics and Walmart is what the two players are there. And it's vague how it started. I know that Walmart had, I don't know if this is a part of the larger effort Walmart has nationally, and not these are sites. Again, we're going to have a call with them, and we're going to vet through what the capacity is and how that could fit within our game plan.
You'll never turn away tests, I imagine, from what you've said before, but do you ask others go about this a different way if they want to do something like this?
Yeah, you can't change your game plan and your methodology to testing midstream. So right now the testing, we've had over 7,300 tests that have been done, in the way that all of them have come through at various testing locations was a doctor was going off of CDC and New York State health guidance. And so when we're talking about our box-in strategy of identify, quarantine, and then monitor, boxing in the risk, you don't change the methodology of that mid-game, okay? And so whatever capacity comes in, this is unique. Normally we're out trying to grab the capacity, and we're working very hard. We're very happy that our partners are getting rapid testing, but we still foresee testing being some level in some role in a restart. What that role looks like, we'll figure out because of the overall capacity for testing. But this was a little different. It doesn't mean that this still can't be part of the overall response, but it needs to work within our game plan, not the other way around.
I have a related and unrelated question. It's just about testing capacity in general. Because these other hospitals are coming on board with their own rapid testing, does that expand the number of test kits available, or is it pulling from the same raw material and just making it at a bigger footprint?
Yeah, it doesn't mean you have more kits. It just means you're getting back the results faster. And so we haven't had a challenge with kits for the last few weeks. The reality is, though, that the number one plan for a restart, or if forget a restart, just for identifying, would be if we could test everybody. and then we could do that within 3 or 4 days, because then we could essentially identify everything. Then you have your 2-week pause, and then we're through. There's not that many test kits available, so testing could play a role in a restart when the data merits it, but it can't be the restart, or else we're going to be sitting around for a long time, because there's no way you're going to see a test kit available for every American in 2020, in my opinion. Maybe I'm wrong. Hopefully I am. Tim?
Ryan, have we seen any downstate patients yet come to the hospitals in Syracuse?
Yeah, I have not heard. There was talk about potentially having some downstate patients come up to some of our hospitals. That talk has not happened yet. Certainly, we were really proud of Upstate sending 22 more medical professionals down to Stony Brook, and my friend Steve Malone, who is really faced with an amazing challenge right now in Long Island. So we're happy that we saw that. Certainly we plan for capacity for the worst in the hospitals. Right now that hasn't happened. That's very good. We would love to see hospitals start to bring back some of their regular duties and some of their regular surgeries, but there's no PPE yet, so that's what's holding that back. Is I'm sure if we would be able to make a case to the governor, and he would agree, if we had PPE, we could start having the hospitals performing more regular duties each day as well. But there's no downstate patients yet, and we'll see if that happens.
Is there any likelihood of getting the PPE necessary to do some of the elective surgeries?
I would love that to happen. It's an aggressive marketplace. I heard the governor talking about it earlier. He's having some of the same challenges that we are. And the state gave us a small supply of some PPE. We're out trying to buy it. You buy it, you think you're getting N95s, you get them, they don't pass a fit test. So then do you keep them or do you return them because you can't use them the way you wanted to? So there's a lot of challenges. This is a real business opportunity for somebody who gets smart. Hopefully they live in Onondaga County.
Just briefly going back to the East Syracuse testing site, you had mentioned there will be a call on the site.
Yep.
Can you talk about when that would be?
Yeah, we'll probably either tonight or tomorrow morning. Okay. These are the types of things that, again, we put forward a strategy with all our partners. I think it's worked. We're in a position where we're not over capacity. Our health department's still able to quickly identify quarantine in their investigations. You don't want to change the way you've been operating midstream, and especially if you're seeing success. So we'll have a call. We'll figure out how that extra capacity can be utilized to benefit the plan, and hopefully they'll agree.
Then as far as, do you have any information or updates you can provide us about New York State schools? Because as of right now, we don't really have an answer of if they'll be closed for the rest of the year or not.
Yeah, I think that's going to be the governor's call. We've talked about that. If the data shows that in our community that we're starving this virus and we're beating this virus, that our community has a better case to make for opening schools. And in my own opinion, and I'm speaking for myself, and again, there's many people that are going to be looking at the mayor talked about our economic resiliency task force. In a restart scenario, and we're not there yet, I would think we would phase in some non-essential businesses first before we talk about schools, and see if that triggers a COVID round 2 scenario where the COVID starts to come back and be more prevalent. And then if that doesn't happen, then maybe you look at schools. And certainly I've been sympathetic to our high school seniors. If there's a way for our high school seniors to be able to get back, even if it's 2-3 weeks, I think that would be great. But you can't make those decisions in a vacuum. The data's got to drive that, and we have to beat this virus. How do we beat it? We starve it. Other questions? The mayor or myself?
Yeah, so the I'll go again. The state is reporting just one Onondaga County assisted living resident has died from COVID-19. Is that number accurate? And will the county be transparent moving forward if there ever is an outbreak at a nursing home or assisted living center?
Well, we're always transparent. I don't think there's anybody been more transparent since this process started. So transparency, of course. There is one confirmed death related to a nursing home, so that's accurate. We are concerned about nursing homes. We are looking at from the beginning of this process, we've been concerned about nursing homes. Nursing homes fall under the New York State Health Department. In the beginning of the process, that's an easy answer if you're me. It's not my job. Now, knowing what I know related to how stressed the New York State Health Department is across the state, I believe we need to play a bigger role in helping support our nursing homes. And Dr. Gupta and I have had those conversations, and we're going to be playing a bigger role, and hopefully we'll be able to talk about what that role is in the near future.
Does that one person get moved to a hospital where he or she dies, or is this go into that column because that person died within the
Andrew,
facility?
that's a good question. It may be some nursing homes have the medical capacity to treat at the nursing homes, and then that individual may stay there, or I'm not sure in this case if that individual was moved to a hospital and then passed away in the hospital or not. But I know it probably depends on the facility and what their capacity is.
Ryan, how stressed is the health department in terms of working with people to release them from isolation and quarantine? Do they have a backlog, or are they able to?
Yeah, I think it's all certainly they're more stressed than they were early on in this process. The more recoveries we have, the better that is. Our quarantine numbers and recovery numbers have dropped this past week. Remember, from a timing standpoint, a quarantine, and again, we want to thank everybody who's in a quarantine because many of these people won't ever develop symptoms. But you're in a quarantine automatically for 14 days. There's no, if you're a positive case with CDC guidance, you can show improvement in 7 days, and within those 7 days, your temperature, if you don't have one for 3 days, you may get released before an individual who is in a quarantine because of you is released. So quarantine is a real sacrifice for our residents, and I want to thank them for that. You're not going to, the people in quarantine aren't going to hear from our health department every day or every other day or whatnot. We have text messaging. They can utilize that technology. But we are tracking it, and then we go through it. But this is a process. And again, when we talk about why it's important to do what we're doing and social distance, this is another reason. You don't want to be in a quarantine because you know somebody and you were somewhere you shouldn't have been who was positive. Quarantine is no fun, especially if you believe you're there and you shouldn't be there. That's really no fun then.
But I mean, are they able to keep up with somebody when their 14 days passes, or?
Yeah, I think for the most part, Tim, you're always going to have an outlier or two, and you may have somebody who thinks they're at 14 days, but we don't agree with their timeline too, right? So we have lots of volunteers. Our health department's working overdrive. They work every day. They work on holidays. They work on Sundays, and they're certainly, I'm sure there's 1 or 2 cases where somebody may have been in their 15th or 16th day in a quarantine that happened. I'm not going to say it hasn't happened, but on the most part, the health department is performing very, very well in meeting what are unbelievable demands on them. And mind you, when we're talking about my employees at the health department, they're dealing with people that are very sick through this process. They're dealing with them in various times of need, and there's an emotional tally that these employees have, and then they've lost some of these people that they've gotten to know. So I'm just very proud of the work that our health department has done.
Ryan, what's in the water in Elbridge?
Hopefully it's very clean water. I know most of it comes from Skinny Atlas Lake, so I know it's very clean, but certainly Supervisor Richardson takes social distancing very seriously. I have a feeling he's been like our own little social distancing bandit police out there. So I'm very proud of Elbridge and everybody else. I think overall the data shows that things are turning for us. What we can't do is get complacent in the process. And if we get complacent, the data will go the other way and we'll be in the standstill. We'll be back right where we were a week and a half ago. So it's working, and I'll share some stats with you in a second, which is our good news, that shows it's working in other ways.
Back to the nursing home death, can you tell us which nursing home that occurred at?
I don't know which one, Tim. I know we're looking at all of the nursing homes, and we are going to come up with our own strategy to make sure that these are isolated incidents. We're very concerned about it, nursing homes. We always have been. New York State is under a lot of pressure right now, and their resources are being stretched, and so we think we can help, and we're going to help. So we just got to finalize some things to talk about what that is, but we're concerned about nursing homes. We're absolutely concerned about them.
So you know that from the state health department that there was one at a nursing home, but not which one?
I don't know which one. I know from Dr. Gupta as well that we had one.
I know you don't control the sheriffs the same way, and you said you've given them, the sheriff deputies, all the resources that they need to enforce social distancing.
Yeah.
But is the county following similar protocols where they try to limit interactions and warn people in the first encounter that when they see something happening?
Yeah, and I'll let the mayor touch on this, but essentially I believe the sheriff and SPD are coordinating their response similar. And I know that the sheriff has gone out. I think yesterday they went out to a couple of repeat offenders from businesses that have been deemed non-essential. We could follow up with them. Again, in my day, that type of detail compared to what I'm dealing with all day is so not on the top of my priority list, or else I know it's really interesting for people. But the sheriff, when we give them complaints, I know when I get them in my email box, I'll email them directly, and then they respond back to me about, we broke up these lines at this ice cream stand. We did this, we did that. The ice cream owner is going to work with us on this or that. So I know that they're doing some of the response. I think they fall in the same boat as what the mayor was saying. At some point, you have to make that decision, and your choices are a fine or a arrest. And depending on the circumstances, they're using a judgment call. Mayor, is there anything else you wanted to?
Yeah, just wanted to emphasize that there is constant communication and dialogue happening between police agencies, and the Syracuse Police Department believes that the way in which they're enforcing the orders is consistent with other local agencies. So they are coordinating, so there's consistency across the board.
Okay. Other questions? Okay, let me give you some data. We talk about social distancing, and there are those who don't believe it works. I read about them. They troll me on my online activity. But since we've started social distancing, we've been monitoring our respiratory illness. Remember, weeks ago, it feels like years ago, the mayor and I were together, and we were talking about canceling a parade, a very popular parade. Yeah, part of the reason was the data. And the data we were looking at was respiratory illness in Onondaga County. And so on the week of March 1st to the 7th, this year we had 211 cases of influenza A and B, compared to 192 the year before. On the week of March 8th through the 14th, we had 230 cases of influenza A and B, compared to 125 the year before, right? That's the week that all of our medical community is very concerned. Social distancing goes into place. The week of the 15th to the 21st, 120 cases compared to 136 the year before. The week of the 22nd to the 28th, 40 cases compared to 73 the year before. The week of the 29th to April 4th, 8 cases compared to 68 the year before. And the week of April 5th to the 11th, last week, we had 0 cases of influenza A and B compared to 60 cases the same week the year before. To all of my trolls, I won't give you the street credit of naming your Twitter names. Social distancing is working. Thank you.